If this doesn't go well, Bubby's got 1 to 2 years to live.
On this episode,
we're puncturing the heart so you can trigger fatal heart rhythms.
This is probably the most critical part.
Did you hear that? I don't know why he's doing that, mate. Like, I don't know.
Where are we now?
This is an absolute snake paradise around here. Oh, watch that. Here we go, here we go. Have a go at this. I need to be really careful. 1 drop of venom from it can kill over 100 people. Please, play nice. Oh, mouth open, ready to strike.
but first...
She's hurt herself! Grab her, grab her, grab her!
Fire. Puppies sometimes fracture their growth plates, and that's disastrous if that's the case. That should be all just one bone.
She's just so little and so helpless. We just want to do the best for her and have the best outcome.
I'm trying to get these down. Get in there and it moves away. Get in there, it moves away. You can do it, Robert, you can do it. A whole lot of things that can go wrong for us at this point. I'm not happy with that.
She's hurt herself! Grab her, grab her, grab her!
Come here, sweetheart. Come here.
In Sydney's West, Greyhound rescuer Christine has brought a distressed Jemima to Rob for emergency treatment.
It's all right, darling. It's all right. She's 4 months old, and she's, you know, absolutely beautiful greyhound puppy, and she's broken her leg just playing with the siblings.
Oh goodness, this is the dog with the fractured leg.
Yes, it's okay. Jemima. Yes.
Jemima, come in, Chris.
Yes.
Come in.
Rob bypasses the normal consultation
Just up there's fine.
to anaesthetise the distraught 4-year-old.
So we'll get her on the drip straight away, knock her out. Christine has fostered a lot of greyhounds, given them a second chance, so I know it must be something serious, which she said, coming down with a fractured leg in a puppy. Look at that face. Who couldn't love you? Eh? Look at those eyes. You're gorgeous.
I just fell in love with her as soon as I seen her, you know. I just wanted to help her and care for her and get the best for her because she's just so little and, you know, so helpless. We just want to do the best for her and have the best outcome.
All right, baby, we'll get you out of pain now, eh? Let's do this.
Good girl. She's a very brave girl.
There we go. She's asleep. Good girl. Puppies sometimes fracture their growth plates, and that's disastrous if that's the case. It means that that leg won't grow properly and will have lots of trouble right through its life. Yes. Once we see the x-rays, I'll tell you what we have to do, whether it's a cast, which would be nice, or operation, where we have to put a plate in it.
She's gorgeous, she's happy, she's playful. We've just been really worried about her and her welfare and whether Rob could save her leg or not.
Ready, fire. Okay, we've got a fracture right through that main bone of the ankle, that piece of bone, and this piece of bone here. That should be all just one bone, but you can see the separation. A lot of pain. It explains why this poor dog was so uncomfortable. Poor Bubby. You see how the hock, the good one, has that point there? See how it's missing there?
Yes.
So that's, actually you can feel it's fractured off. That should be way up there somewhere.
Yeah.
That's the Achilles tendon, and it should be way down there somewhere. So we've got to try and push that right up there and stabilise it. Yeah. So there's a lot of tension just to even try and get that back.
Yeah.
It's not good news. Jemima needs complex surgery on her hind leg if she's to have any chance of walking normally again.
Good girl.
Hey Buff, how you going, Bubby? Good boy.
In Sydney, Mary and her daughter Mia have arrived at the Small Animal Specialist Hospital for what they hope will be a life-saving day for their 8-year-old cat, Bubby.
Hey Bubby, how are you feeling?
No, Bubby.
We've had Bubby since he was 12 weeks old, so a big part of the family. But he has a block from the upper chamber of the heart to the lower chamber of the heart, and he's got an enlarged heart. It's very serious. So Bubby's having a pacemaker implantation. If this doesn't go well, Bubby's got 1 to 2 years to live.
All right. Yeah, you're okay. You're so cute.
Mia was really traumatised when we got the prognosis. She has an amazing relationship with Bubby. So he follows her around, up and down the stairs. They sleep together. They are very, very close.
Hi, I'm Caitlin.
Hi Caitlin, I'm Mary.
I work alongside the cardiologist and I'm here to admit Bubby today for his procedure. And he's feeling good this morning? You haven't had any issues with him?
No, he's obviously nervous, so we can tell. He's not running around like he usually would be, so he's obviously feeling a bit apprehensive like we are.
Yeah, for sure.
The best case scenario would be the pacemaker will fix the blockage, his heart will reduce to a normal size and he won't have heart disease.
So he'll probably stay with our ICU department after his procedure?
Yeah, sure.
Yeah.
Bye, Bubby. You'll be right, mate. Bye, Bub.
Bye.
Bye, Bubby. Bubby. You'll be right.
Yeah.
Thanks very much.
That's okay.
Thank you.
That's all right. Yeah, we'll give him lots of love for you and we'll keep you updated throughout
Great.
the whole time, okay?
Thank you. If we do it and it doesn't work, well, we've done everything we can. If we do it and it works, it's a fantastic result and we'll all be very happy. We love him. We absolutely love Bubby. And we want to do whatever we can do to keep him with us for as long as possible. Well, that was hard.
Yeah.
Anyway, we're doing the right thing, Mimi.
Yeah.
It'll be all good.
Yeah. It'll happen. It'll be good for him.
Yep. Just get through the day.
Yep.
Hey, Bubby. You coming out?
Push that right up there and stabilise it.
On the outskirts of Sydney, Rob and his team are about to start surgery on 4-month-old Jemima, hoping to fix her severely fractured rear ankle.
Our surgical site will be right down the back there.
So along here?
Yeah. If we don't fix this properly, she'll end up with a big arthritic ankle and in pain all the time. The pain would never leave her. She can't use her calf muscle properly, the Achilles tendon's useless to her. It would just be a continuous life of pain. Her heart rate's still fast. I'd like to just steady down a little bit. Greyhounds are very, very sensitive with anaesthetics. Their heart rate can go up and down. Their electrolytes go out of balance very quickly. They are always a worry under anaesthesia. And when you've got a little pup, the smaller the pup, the more the worry. So this is our piece of fractured bone just there. You can see it wobbling along. And we've got to bring this right back here. So we'll cut above it and come down this side. My ultimate goal in this is to try and get stability in this fracture line. Bring the two fragments together that have just literally been smashed apart. Bring them together, hold them together, so Jemima could go to a good forever home. Okay, so we'll need the drill. We'll put the pole through there. Put the wire through and then put the 2 pins in, do it up. Sounds simple enough, doesn't it? I wish. Okay.
As Nurse Anne closely monitors Jemima's vital signs.
And again. Stop there.
Rob and Nurse Liz are finding restructuring the young pup's severely damaged ankle is a massive challenge.
Okay, let's find out if we can put enough tension for that to heal. What I'm trying to do at the moment is literally bring these bones where the fracture is so that there's bang, which will allow them to heal. I'm not happy with that. Trying to get the alignment correct is difficult because things are being pulled apart all the time. I'm trying to get these, get in there and it moves away. Get in there, it moves away. You can do it, Robert, you can do it. Come on, you can do it.
It's a big day, Bubby.
Good boy.
At Sash in Sydney, 8-year-old blue Burmese cat Bubby is about to have a pacemaker surgically implanted to fix her dangerously low heart rate.
Good boy, I know.
Dr. Tristram will perform the operation that hopefully will reduce Bubby's enlarged heart, as well as correct the abnormally slow heartbeat.
Obviously the priority is going to be getting the cat safely through this.
Normally, the way that your heart functions, it has its own pacemaker you're born with that regulates your heart rhythm. That's how fast your heart beats and how the electricity that your body produces is conducted through the heart muscle itself. But in Bubby's case, the body doesn't do that job perfectly. So the plan is to place a device that allows us to control Bubby's heart rate that's placed externally on the surface of the heart.
So we're going to access the heart via the abdomen. That's how we're going to place the pacemaker. There's going to be 2 little electrodes or leads that are going to be attached to the heart muscle that allows us to pass the current to control the cat's heart rate. Without placing the pacemaker, how do we think the cat will do?
At the moment, the problem in this cat is that it's probably affecting his quality of life.
Cardiologist Dr. Inaki has been treating Bubby's heart condition and will carefully monitor the progress of today's surgery.
When you have a heart rate that is going too low for a long period of time, the way the heart responds to that is like it stretches, and at some point you can start building up fluid in your lungs or in your abdomen. So this is heart failure.
We're just about in the abdomen now.
You have a dangerously low heart rhythm that can be life-threatening. Some cats can survive surprisingly long periods of time without any problems, but unfortunately some of them can also drop dead without much of a warning.
There's 2 little electrodes. These 2 things are going to attach to the heart. This will attach to the battery at the other end. So we're just about to place the pacemaker leads to the heart. This is probably the most critical part.
This is where things can definitely go wrong.
Okay, that's the first bite.
We're puncturing the heart, so you can trigger fatal heart rhythms. So we need to be very prepared with our defibrillator and just be ready for anything, like if he were to arrest, or like if the rhythm changes, maybe we need to intervene.
Just go a second bite into the heart.
This is an absolute snake paradise around here.
In tropical northern Australia, Billy is on a very important but dangerous mission for the Australian Reptile Park.
I'm up here on assignment for the reptile park here in the Cairns cane fields, looking for literally one of the world's most venomous snakes. Over the next 12 months or so, I'm going to be collecting snakes from all over Australia for the venom program at the reptile park. I'm looking for coastal taipans. They're the 4th most venomous snake in the world. I need that species because we use their venom back at the reptile park to produce life-saving anti-venom. Now, I've been told by one of the local cane farmers he's been seeing a taipan here late in the afternoon. So I'm just scouting this edge, looking along. It's perfect conditions right now. It's nice and warm. There's plenty of rodents holes here that the snakes, you know, they'll be feeding on these rodents. Lots of cover, and there's water right behind me. But I'm also being extremely cautious. This species is literally one of the most toxic snakes on the planet, and a bite would be bad news. Coastal taipans love these sugarcane fields. They're great places for them to live, hide. There's always heaps of food around, like rodents. And in fact, this cane block here, the local farmer calls it taipan because he sees that many there. Where are you hiding, little fella? When I'm working with taipans, I've got to be super careful. In captivity is one thing. Out here in the wild, complete different level of danger. So I'm always extremely cautious. He's got to be here. He's got to be here somewhere. So I've just got to keep working in and out of the cane here, slowly looking, moving in. There literally could be 10 of them around me. Come on, mate. I know you're here somewhere. Whoop. Look at that snake.
You can do it.
In Sydney's west, Rob and his team are struggling to reconstruct the shattered ankle of young rescue greyhound Jemima.
If it snaps, it snaps. The wire can snap, the pins mightn't be stable, a whole lot of things that can go wrong for us at this point. Yes. And that brings that bone a lot straighter using that hock area. That's good. Gotcha. Yes. Beautiful. 2 pins and 2 wires. And it's holding that bone exactly where I want it to be. We might just get what we want here. The fact that I'm putting a lot of pressure on it and it's not falling apart, very, very happy.
With Jemima's rebuilt ankle joint finally stable,
okay, let's get some 2-0 suture, please.
Rob begins sewing up the wound.
Just close very slowly, 1 stitch at a time.
But there's one major hurdle still to overcome.
We're struggling. We pulled the tendon over and now we're getting the tissues from the 2 sides together to cover everything that we've put in there. Not easy to do because truly there's just not a lot of tissue here. Let's face it, greyhounds, there's no fat on them, there's nothing to protect them. They're all muscle, sinews and skin, that's it. So we're just going to be very cautious. I'm concerned because there's the risk of this breaking down.
Come on, mate, I know you're here somewhere.
In far north Queensland, Billy is searching for extremely dangerous taipan snakes to produce anti-venom.
Over the next 12 months or so, I'm going to be collecting snakes from all over Australia for the venom program at the reptile park. And coastal taipans, they're one of the main snakes we milk.
The serum could mean the difference between life and death for anyone bitten by a deadly taipan.
Oh, what's that? Whoop, look at that snake. Nothing there. Now the taipans I want to find, they're the ones that are over 5 foot in length. They're the ones that are going to start producing big venomules, and that's what I need with the venom program. Just easing my way through. So I'm coming along the edge of the cane. Peel a bit back, and just out of the corner of my eye, this bit of glare. Here we go, here we go. And sure enough, right there, baking in the sun, is this beautiful coastal taipan. This is the coastal taipan. So this snake here is in the top 5 most toxic snakes on the planet. This one's only a sub-adult. They get much, much larger than this. All right, but this is a great sign for me. This means that in this area, they're breeding. Back at the reptile park, I milk these snakes every 2 weeks, and I need about 24 big adults. Before antivenom was actually around, the coastal taipan, they were called the killer of the cane field, because when people got bitten by these snakes, there was a 100% chance that person was going to die. Super toxic venom, really fast acting. They've got the largest set of fangs of any Australian snake. All right, they can be 10 mil in length, and their venom yields are absolutely frightening. An adult taipan can produce more than 450 milligrams of venom in a single bite. So that alone can kill over 100 grown men. You know, we're going back to the late 1950s here. And if you were bitten by one of these snakes, it was a death sentence. Depending on where the bite was, your age, health issues and that sort of thing would determine how much longer you actually had to live. I need to be really careful.
Billy must now make a decision on whether to take this taipan back to the Australian Reptile Park to include it in its anti-venom program.
Please, play nice.
But the snake is becoming increasingly agitated. Billy needs to make his mind up fast.
Oh, mouth open, ready to strike.
So we're just about to place the pacemaker leads to the heart. Okay, all right, so that's the first lead on. So I'll try with the second.
In Sydney, Tristram is halfway through the critical process of surgically attaching 2 electrical leads from a pacemaker onto the heart of Bubby the cat.
Right, can you just gently put a finger on the lead there? Yeah, and then this finger just gently pushing that down, if that's okay. There we go, that's good, man, thank you.
Has the heart rate gone up?
Did for a second.
Cardiologist Inaki watches anxiously, hoping Bubby's heart won't suddenly go into a fatal arrhythmia as the leads are being attached.
There's a couple of small holes in the lead, so you suture the lead into the heart. The pacemaker is going to keep Bubby's heart rate at a normal rate for a cat, which hopefully will reduce the risk of dropping dead all of a sudden and will hopefully also prevent Bubby's heart from going into heart failure.
Do you want black one here?
Yeah, black back.
So black at the tip?
Yeah. It works both ways, to be honest. Heart rate will probably go up now to 120. So the second pole of the lead is connected now. We're gonna attach some cables that are gonna connect directly to this machine over here. And this is gonna allow us to just do some testing and to make sure that is attached where we want it to be. It's gonna go down to 2. So it's still pacing.
At the moment, they're just trying to work out how low we can bring the voltage, because the lower the voltage that sustains the heart rate, the longer the battery's going to last. So if we have to run it at a higher voltage, we may have to change some of the positioning of the leads.
Okay, back to 3. I'm just going to go to 2.75. We're going to slowly drop the energy, and we're hoping that even with low energies, the heart is going to continue to beat at the rate that we've given it, which is 120. It's going to go down to 2. Did you hear that? Like it stopped pacing again.
But as the pacemaker's voltage reaches the desired level, it's no longer sending electrical signals to Bubby's heart.
I don't know why it's doing that, mate. Like, I don't know.
Where are we now?
Shouldn't really do that.
We're struggling, but we're getting together all the soft tissues to cover all our hardware that we've put in, the wire and the pins.
In Sydney's Outer West, Rob has been battling to close the wound created while mending the badly fractured ankle of Jemima the Greyhound.
And the big thing is keeping the wire and the pins covered with the soft tissues of the dog, which is essential. Otherwise, they'll tend to burst through, which we do not want.
On the bright side, despite concerns their patient might struggle under anaesthetic, 4-month-old Jemima is doing well.
Well, Greyhound's dangerous. Putting them under, it's dangerous keeping them under, and it's dangerous waking them up. I was a bit concerned, but I'm very pleased now. This skin is coming together very, very nicely. Something special about this pup. And this is very, very satisfying to be able to help this little pup, and it all comes together so well. I am thrilled. There were some moments of sheer panic, to be honest, but at the end everything went well. There you go, baby. That's as much as we can do now. We'll put a dressing on you, some antibiotics, some pain relief.
But before Rob can completely relax,
come on, baby, go.
He needs post-operative x-rays to confirm his high hopes for success.
Oh, lovely. That's the fracture there. Those bones are in alignment. Everything's good. The wire's in position. Yes! That's what I wanted, and that's what we got. Beautiful! Okay.
Jemima's leg will need several weeks to heal, under the devoted care of her adoring foster mum, Christine. But thanks to Rob and his team, the 4-month-old rescue pup now has a great chance of finding a forever home.
Our little Jemima is doing very well. Her bloods have come back very nicely, everything's normal. Christine, she'll be thrilled because she genuinely pours her heart out and puts her soul into rearing these greyhound puppies or even adults that need rehabilitation. She just loves them. And I believe this pup's going to go on to have a very, very good life. Here we go now. You're waking up nicely. Good girl.
Shouldn't really do that. I don't know why he's doing that, mate. Like, I don't know.
Where are we now?
In Sydney, Cardiologist Inaki and surgeon Tristram need to find out why Bubby the cat's new pacemaker isn't working like it should.
Maybe the contact here wasn't very good.
After connecting the pacemaker's leads to the 8-year-old's heart, they can't get the electrical power low enough to ensure its battery will last.
Well, they look pretty good. They're right on the apex. I could move them slightly closer together if needed.
So when we place the pacemaker leads, we're doing this on a very, very small heart that's beating the whole time, and we have to do that incredibly gently without causing any damage to the heart. We can think of it a little bit like trying to repair a car engine while it's running.
I've dropped it even a bit more.
Where are you now?
Okay, so I'm just going to go up to 1.25.
At the moment, we're just waiting to make sure that everything's all nice and secure, because obviously this is a lifelong intervention, so we want to make sure that it's as perfectly positioned as possible so we've got as longer life in the battery, because it's not simple just taking the batteries out and putting a new one in. It's another surgery to replace the batteries, but as long as we can run it on a very low voltage, we're hoping it's going to last for the rest of Bubby's life.
But the pacemaker's leads are found to be faulty, so new ones are attached to the heart and testing begins again.
Let me know when you're ready.
So I'm just going to start at 3 and we're going to decrementally decrease the voltage.
Waiting at the moment to see if the heart rate's being controlled appropriately from the pacemaker.
Now it looks normal, so that's definitely an improvement. I think it's good. You're all good.
So it's in better?
Yeah. The voltage that we're delivering is actually where we want it to be. So yeah, we're pretty happy with everything.
All right, great. Okay, let's see if we can find a home for the generator, shall we?
With the pacemaker now working properly, Tristram secures the battery inside Bubby's abdomen.
Yeah, so we just made a little pocket in the innermost muscle of the abdominal cavity, and we placed the battery or generator for the pacemaker inside that pocket just so it's safe away from the abdominal organs. Okay, that's good.
The pacemaker's left in place for the rest of Bubby's life, and it will take over beating for Bubby's heart whenever the heart rate will drop too low. It'll kick in and correct the heartbeat rate and then drop out if Bubby doesn't need it.
Still pacing at 120? Yay, he is now AAA powered cat. Excellente. So we've got a heart rate that's nice and stable, so that tells us that our pacemaker is working as planned. So we're just going to wake Bubby up from the anaesthetic and see how we're doing.
So what I'll be doing in a few months' time is I'll be coming back up here to Cairns. I'll be scouting these cane fields here for big adult snakes much, much larger than this.
In Northern Australia, Billy is doing reconnaissance to find the best places to recruit deadly taipan snakes for the Australian Reptile Park's anti-venom program.
Really amazing to think their venom will actually be used to save human lives. So even though this snake's only small, 1 drop of venom from it can kill over 100 people. We compare that to something like the Asian cobra, still highly venomous, but a bite from a species like that might only kill about 4 or 5 people. In 1950, there was a young fella and he actually went out to collect the first taipans that were going to be used for the venom program. The first snake he found, right here where I am in Cairns, he caught it, really big snake, about 6 foot. Unfortunately, it actually bit him and he died in hospital. Really, really tragic. But that snake, they milked it and they literally produced the first vials of taipan antivenom for the antivenom program here in Australia. And his legacy still lives on today.
Right now, Billy must decide if he's going to add the venom from this smaller taipan to that legacy.
When I come back, I'm going to be looking for the big ones, 5 to even 7 foot long. They're the ones I need to take back to milk for the Lifesaving antivenom program. Righto, so I'm going to let this little fella go. He's far too small for me to use in the venom program, and I'm not going to be coming up to collect him for quite a few months anyway. But I need snakes that are much larger than this one I'm going to let him go. He's starting to carry on a little bit now. He's probably a bit over me. Yes! Coastal taipan, what a score! I'm absolutely stoked with that. They're literally one of my favourite Australian snakes, and to come here and get one on this beautiful afternoon, I am absolutely buzzing. See you later, mate. All the best.
We've got a heart rate that's nice and stable, so that tells us that our pacemaker is working as planned.
In Sydney, 8-year-old Bubby is slowly waking up after having a pacemaker inserted to correct a dangerously low heart rate.
The recovery for the procedure tends to be relatively quick, and prognosis long-term should be really good. So Bubby is going to have a normal heartbeat, which means that he's probably going to enjoy many years going forward.
Dr. Inaki and the SASH cardiology team will monitor the newly installed pacemaker over the next day to make sure the Blue Burmese continues to show a healthy heartbeat.
You're a good boy.
If there's a lot of movement, there's a chance for the pacemaker dislodging. That can create a problem, but if we avoid that in the next few days, next few weeks, then you'll be able to go back to a completely normal life.
Get out the penthouse. Good boy.
It's a bit of a happy, sad day because we're very happy that she's going home and very sad that she's going home.
8 weeks after Rob performed surgery to repair 4-month-old Jemima's fractured ankle, the little warrior is making strong progress on her way to recovery.
For a puppy to have an injury, it's pretty stressful. We were quite upset about it. Rob offered to help us to fix the leg, and you know, it's been marvellous.
Hello.
Hi.
Hi. Hello. Hello, baby girl.
She's just so happy. She's just a beautiful puppy, full of love and excitement, and you know, she's just going to make a perfect little girl. Can't wait to get her home.
All the best.
Can't thank you enough.
Pleasure.
Good girl.
Good girl.
And her future looks bright for finding the young Greyhound a forever home.
He's cute.
2 weeks after the 8-year-old's anxious owners Mary and her daughter Mia left him at SASH for surgery,
We've got a heart rate that's nice and stable.
a very wily Bubby is back to his active best after the pacemaker implanted to correct a chronically low heart rate is definitely doing its job.
How you going, Bubby? Bubby. He's alright. He's alright. Bubby. Bubby. Come on, you'll be right, mate. Yeah, good boy.
They're relieved to have their much-loved family member home and lapping up all the attention.
Bubby. Good boy.
So Bubby just rules the house. He's very, very playful, very active. Not the sort of cat you would think had a heart problem.
Yeah, you know where we are? Yeah, good boy.